Healthcare Exposed with S.R. Ridley, a nurse you can trust.
Welcome back to Truth Hour. I'm S.R. Ridley, a nurse you can trust. And for those returning, thank you. And for those new to the channel, thank you for tuning in. And for all the subscribers, we thank you so much. We appreciate each and every one of you. And as always, don't forget to hit that button and like, share, subscribe, and comment. We have talked about a lot of different subjects, and the goal with all of this is to keep you safe throughout today's healthcare system. Well, in today's episode, you're going to learn 3 things. You're going to be able to walk away today with 3 things that you can actually implement and stay safe in today's emergency rooms. I was going to do a show today called The New Nurse Practitioner is a Joke, but I had a conversation with a new nurse today, and that conversation is what has given rise to this particular episode. So we're going to break down the layers of healthcare, because this particular new grad, she said that it's been said they feel that I am picking on the new grads, So I am talking about the new grads. I am speaking about the float nurse, and I am speaking about the charge nurse. But I want you to understand that this is not just a 3-tier problem, that this problem is multi-layered. So what we're going to do is we're going to start with, and we're going to dissect this particular faith-based hospital that I've been referring to, and we're going to start with their director. True story. And always begin with a true story. I'm working in the area of what they call fast track. And, there's a new nurse there, and he's in triage. And remember I told you last time that triage is where you have to have your strongest person, not your weakest link. So he's in triage, and he's a nurse of 1 year, and he brings his own chair to work. So this particular nurse said to me, honestly, and I respect this, he said, well, SR, really, I really don't feel safe. I don't know how to take care of critical patients. I don't know how to take up critical patients, emergent patients, all in the same category. He said, when I have to give the life-saving drugs that we talked about, the Levophed, the one that keeps the blood pumping throughout your heart so that your brain, kidneys, and your heart can get blood oxygen, that he doesn't feel comfortable taking care of those medications or giving those medications because he's never been trained. So he went to their director and asked the director, told the director where he needed help, which I respect. And then he told the director that he did not know how to give these life-saving drugs. In the same category of the Levophed, the one that gives you a blood pressure, that helps you live, is another drug called dopamine, another drug called neosynephrine. And you don't have to know the names of these drugs. You just have to know that these drugs help keep you alive. And when they are given to you, you are close to death. Without these drugs, you would not have a blood pressure. And they expect these new nurses to be able to administer these drugs. And these are drugs that you have to titrate, which means you have to know when to go up, when to go down, how much to give. So he was honest. He said he didn't know what he was doing. And I want you to know with this director, now she's been at this particular hospital for, I believe, somewhere between 35 and 40 years. Now, she did begin on the med-surg unit, and nothing against med-surg nurses, but I think she's forgotten a lot here. She told him to read a book. Now he's asking for help because he feels a danger to you, the patient, if you are critical or emergent, and he does not know how to give these drugs. And she told him to read a book. Can you believe that? Read a book. So if you could just go to nursing school and read a book and be competent, then why would you need clinical? Why would you need training? Does that make sense to you? No. So now and then remember in the emergency room, you don't know what's coming through the door. You have no idea when you're going to get a patient or what kind of patient you're going to get. So you have to be prepared for everything at all times. So how are you going to get a book when you have to give the medication? So now you're the patient, you're on a stretcher, you don't have any blood pressure, and your nurse has to go run and get a book to figure out how to care for you, how to give you this medication. Or they make the biggest mistake. They ask the physician. Now I know there are people out there who believe that the physician is always right and that the physician knows everything. No, we all have a role in healthcare. We have a role. The physicians have a role and we have a role. The physicians order the medication. The nurses give the medication. Ask yourself why. Why? That's a fail-safe put in, right? To make sure that the person ordering it isn't necessarily giving it, because then it's too close and you can make an error. And you know what happens when there's medication error? Remember we talked about this case? You do not want to be an accidental human medical error. Let's go back to this director, because I don't want the new graduates to think I'm picking on them, okay? Because they're a victim as far as I'm concerned. The ownership that I expect the new graduates to take one day is I expect them to stand up and tell the truth. I expect them to honor the oath. Their oath is not to the hospital. Their oath is to you, the patient. They owe you safe, competent health care. When you come in the emergency room as a patient, the new graduate nurse owes you to be clinically and academically sound and competent. Okay, I'm sorry. I go off on a tangent. So this particular director is kind of funny. So when I first started at this hospital, remember when I first started, I'm 19 years experience, I'm 21 now. She came in and my patient had a bed. And remember I told you about the token charge nurses, the show me the money charge nurses who only care about getting you in and getting you out. Here's a true example. Now here's the director. And remember, the new graduate nurses, they can only learn from their surrounding. If your director is corrupt and she's corrupt, and if your manager is corrupt and the manager that was there was corrupt, and if your charge nurses are corrupt, who, or just inexperienced and just don't know, who are these new nurses supposed to go to for help? So she comes in, my patient has a bed. Do you know, she doesn't even work the floor. She sweeps in, sweeps out, does a little, she plays around at nursing a little bit. She actually called a report on my patient. She called the report upstairs to another nurse and told them about my patient who she never met, never assessed. She never even saw my patient. She never even spoke to me about the patient to see what medications I had a chance to give, what's the next step, what's been done, what's the plan. She didn't know anything, but she actually violated the Nurse Practice Act. She called upstairs and gave report on a patient that she didn't know. That could have been you. Then she tells me she gave report after the fact. Now, you say, so why is this important? So what's the point? The point is that most errors occur in the hospital due to lack of communication. This particular hospital, not the only one, because another big name hospital, same thing happens, lack of communication. But this particular hospital, even the secretaries practice medicine without a license. The secretaries will call the x-ray and see if they're ready for your patient and tell the tech to take your patient, or tell x-ray they can come and get your patient without even telling you, the nurse, without even asking you if the patient can actually go. Can you believe that? So this lawless institution, not only is the director corrupt, the corruption it's just like a rippling effect. It's like the domino. Boom. And who suffers? The patient. So if you're a nurse and you're looking, you don't even know your patient's gone. How are you gonna take care of your patient? So if your patient goes over to x-ray, most people know what x-rays are. They're either doing the x-ray of your chest, they could be doing the x-ray of your abdomen. These patients have gone over to these departments due to the execution and decision and medical practicing of the secretaries without the nurse's knowledge. Now, in what institution, in what healthcare system do secretaries practice, execute medicine? Unbelievable. But their director sanctions this behavior. So of course you're a problem. You're a problem. When you want them to do their role, like, talk to me, the nurse. Do not send my patient. Remember, I have a license. Don't send my patient somewhere and I don't know. You don't even know if the patient had their medication. They've had their IV put in. I showed you a little apparatus that goes in the arm. They've even gotten their medication. And then what they do is they ask the doctor. Well, let me tell you all something. For all of you all who just believe in the doctor. When the doctor comes to see you, remember I told you we all have a role. When the doctor comes to see you, they write your medications. When do you see your doctor again? Ask yourself. An hour, 2 hours, 3 hours, 4 hours? Do you ever see your doctor again? So when the secretary asks the doctor, is the patient ready to go? The doctor hasn't seen you. They don't even know. They don't even know if you're in your room. They don't even know if you're stable. They don't know anything unless the nurse relays it back to them. So why would the secretaries think that they should ask the physician when the physician doesn't know what's going on with the patient at that time? Let me wrap up here. So that's the director. So the director, she sets the tone. Right? Then you have the manager. And let's go to the charge nurse. Now, if your director is sanctioning this behavior, then your charge nurses are also sanctioning this behavior. And then I told you about the charge nurse she's a charge nurse now, and this is the scary part. I told you about the nurse of 11 months who's actually training nurses who walked back a stroke patient, who took care of a patient having a heart attack and never realized that when she gave the medications, that she assumed care of the medicines. She asked me to falsify documentation. She wanted me to document that she had given the medication. Let me rephrase. She wanted me to document that I gave the medications that she gave. I wasn't even in the room when she gave the medications. First of all, even if I was in the room, new nurses, listen to me. True story. Do not document a medication that you did not give. That's called falsifying documentation. For all the lawyers out there who could be listening, you need to check the nurse's notes first. Nurses do not document today. Today's new nurses do not document. Chapter 11 is the bonus chapter for you, called A Lawyer's Dream. Back to this particular new nurse. Do you know that they have put her in charge? Do you know she is actually in charge? So she doesn't know her role as a nurse. She can't train new nurses because she's not clinically and academically sound. She has no experience because most of her year and change has been as a float nurse. It hasn't even been maintaining ER nurses. This nurse dodges patient care like your kids playing dodgeball. I mean, she absolutely tries to avoid patient care. She puts herself either in triage, weakest link, where your strongest link should be, or as float nurse. So she doesn't even have 75% of ER, just a brief moment of time of managing a patient, and now they put her in charge of the emergency room. Unbelievable. I thought I was going to have a heart attack when I found out.
Thank you, and see you next Wednesday for Truth Hour, Healthcare Exposed. And don't forget to click that button now and subscribe, comment, share, and like. And then I, SR Ridley, a nurse you can trust, want you to get mad and hashtag My Life Matters and let healthcare know that you are not going to take it anymore. Because in healthcare, all lives matter. Are you safe in today's ERs? Next Wednesday.